Hello again, and welcome to the third part of Laudio's webcast, Reclaiming the Fine Art of Listening Well in Healthcare. And joining me again and leading the conversation is Dr. Cynthia Clark. Cindy has been a nurse for more than 35 years. She's the Strategic Nursing Advisor for ATI Nursing Education and a contributor to Laudio's Frontline community. Cindy is Professor Emeritus, founder of Civility Matters, the author of Creating and Sustaining Civility in Nursing Education, and is an international expert in fostering civility and healthy work environments. So Cindy, it's so great to have you here with our final segment in Listening Well. So my first question for you in this segment, which is all about leveraging a new framework for engaging in conflicted conversations, is what is PALE? And why is this strategy so effective when starting difficult conversations?
Love the question, and I love PALE. So let's begin by defining what it is. So PALE is a conversational strategy to help us foster effective communication. So PALE stands for, P stands for preview, A stands for advocacy 1, A stands for advocacy 2, I stands for inquiry, and L stands for listen. And we have a slide on this in just a moment. But before that, I want to talk a little bit more about what PALE is. So first of all, we have to give credit to the Harvard Center for Medical Simulation in Boston. And the group there created PALE as an evidence-based strategy for conversation. And it is based on what's called the basic assumption. So the basic assumption is this, from the Harvard Center for Medical Sim, is that the basic assumption is this, that if I'm going to engage with you, I'm going to extend to you positive regard for you. So we extend positive regard for the other person, which begins to lay the groundwork for effective communication. So the actual verbiage in the basic assumption goes something like this. We believe, or I believe, that everyone is intelligent, capable, and cares about doing their best and wants to improve. So what that really is, the basic assumption is also what I often call assuming goodwill or assuming best intent from the person with whom we're engaging. So Tom, if you would go ahead and put that first slide up.
Sure.
So mention that PALE, so P-A-A-I-L, those first P's. So when you use this strategy, preview is where you give the other person a preview of what you'd like to talk about. Advocacy part 1 is where you express in very objective terms what you saw or heard or noticed. And part 2 of advocacy, you're continuing to advocate to understand more about it. This concerns me, or I think. Inquiry, you might start with, I wonder. And then L, my personal favorite, is to listen. That we step back after using PALE for the final step, which is to listen carefully and intentionally to the other person's response.
So can you give then an example of how PALE as a strategy can be effectively used in engaging in these conflicted conversations, Cindy?
You bet. If you can put up the scenario with Carmen.
Okay.
And so this is a fairly typical scenario that we might see in just about on any floor in any department. So it goes like this. Carmen is an experienced nurse who has made it abundantly clear that she has little or no patience interacting with new or experienced nurses. Chris is a newly graduated nurse, reaches out to Carmen, asking for help about a patient's situation. And Carmen responds very rudely and said, I don't have time for novices. I've got more important things to do. All right. So Chris decides to address this situation. So Tom, if you can go to the next slide, I'll show you how you might use PAIL. Because I think some of us are tempted to like give it back, right? But if we think about reframing it and using PAIL, it might go something like this. And I always like to start with the person's name because it helps us relate, it helps us connect, it personalizes the interaction. So Chris might start out with something like this. Carmen, I'd like to talk about our working relationship. I've noticed that you seem reluctant to discuss patient care issues with me. I'm concerned about our lack of teamwork and that it might affect patient outcomes. What are your thoughts about my concerns? And then I listen. This is a really particularly, I think, potent strategy because it's really showing regard. It's asking for their observations of how they see the situation as you listen carefully before you respond. And so while there are lots of other frameworks, some of them quite excellent, used to structure challenging conversations, PAIL is definitely one of my favorites because it really stresses the essential skill in what I call the gift of listening. So I hope you have found that helpful.
Well, thanks so much, Cindy. I think these tips are so valuable because we know that everybody's under so much stress right now. And it is so important to step back in conversations with other people who are stressed to be able to plan the conversation that we're going to have, both in terms of what we say and what we listen to, and then how we respond to what we've learned. So, so critical at this moment in time, and hopefully our audience finds this as valuable as I do. So really, thanks again for participating in this and leading this three-part series. And we look forward to a future series with you going forward.
You are so welcome. And so just as we close, I just want to personally thank you, Tom, for hosting these sessions. And I want to thank our viewers for all that you're doing every single day to make the world a better and safer place. And I just wish all of you good health and wellness. Thanks again, Tom, and take care, everyone.